Hello, dear friends. As usual, we will continue the study of medical diagnosis. Last time we have seen some taste of urine and the normal contents of urine like amino acids, then ammonia, urea, uric acid, creatinine, etc. Now we will see the third group of neutral sulfur. These are also contents of the urine, and these are unoxidized sulfur and contained in cysteine, taurine, thiocyanate or sulfides. They do not vary with the diet, and they are mainly the products of endogenous metabolism. So other organic compounds includes the chlorides, then these are excreted as sodium chloride, then phosphates. This consists of sodium and potassium phosphates. Then greater part of phosphates includes organic phosphates, example nucleoprotein, phosphoprotein, etc. Then phosphate excretion is increased in certain bone diseases such as osteomalacia, wasting disease of nervous system, or renal tubular rickets. So in urine diagnosis, if phosphates are excreted in increased amount, then these probability of these three diseases may be there to the patient. That is osteomalacia, wasting disease of nervous system, and renal tubular rickets. Then marked increase in phosphate excretion is also observed in hyperparathyroidism and decrease in hypoparathyroidism and in some infectious disease infection. About phosphates, oxalates. The amount of oxalate in the urine is low, means 20 milligram per day, and found in calcium oxalate crystals in urinary deposits. The excretion of oxalate is increased by ingestion of fruits and vegetables containing high oxalates. Large quantities of oxalates are excreted in urine in inherited metabolic diseases. So minerals. So 4 cations of the extracellular fluid. These minerals include sodium, potassium, calcium and magnesium. These are present in urine. So sodium content varies with intake. Urine potassium increases when the intake is increased in or excessive tissue metabolism. Then calcium and magnesium are not completely absorbed and their presence in the urine is low. Next is the enzymes. So trace amount, the enzymes are excreted in urine like pancreatic amylase, pepsin, trypsin, lipase. The pancreatic amylase excretion is increased in pancreatic disease. Some hormones and vitamins are also observed in urine. So certain hormones like sex hormones and vitamins like B and C vitamin are found in urine. These vitamin needs are assessed by studying the urinary output after test doses, and the pregnancy test is also performed by the urinary sex hormones. So abnormal constituents of urine. So these all what we have studied are the normal constituent. Now what are the abnormal constituents which should not be appear in the urine, and if they appear in urine, the patient or the person is definitely a patient or abnormal person. So presence of abnormal constituents of urine indicates happening of certain abnormality or the disease, and something is not proper to the body. In short, we can say. So first, proteins. If proteins appear in urine, then proteinuria might be the disease caused to him, or we can traces of protein 10 to 100 milligram, 150 milligram ranges. Then urine cannot be detected by ordinary sample test. Then pathological test is needed. Uh, then serum albumin test, serum globulin test, hemoglobin, mucus protease. These are found in urine. Is a severe symptom that something is abnormal to the patient. Physiologic proteinuria. In this condition, less than 0.5% protein is present in urine, which occurs after severe exercise, after a high protein uh, meal, high protein meal, or as a result of some temporary impairment in renal circulation when a person stands erect. In 30 to 35% of pregnancy, there is a proteinuria. So pathologic proteinuria is marked in glomerulonephritis, or proteinuria is also resulting in poisoning of the renal tubules by mercury or arsenic or bismuth. So hemoglobin is also present as a result of hematuria due to the hemorrhage from the kidneys or urinary tract. Then mucus is the term for an unidentified protein precipitation or precipitated by acetic acid. Then proteose may be found which is of little clinical significance. Benz-Jones proteins found in the urine are the peculiar proteins which are light chain fragments of globulins, and most commonly they occur in multiple myeloma and rarely in leukemia. So these are the general symptoms. Glucose, that is well known to all of us, that if glucose or sugar appears in urine, the patient or the person is known as to cause of glycosuria, or we can call in short we can call it as a patient of diabetes. The presence of glucose must be treated by Benedict's test, so that we can give the, or Osage-Hone test, we can detect the percentage of the sugar or glucose in the blood or urine. In other sugars like fructosuria or galactosuria or lactosuria, then pentosuria, because sugars are present in different materials, not only as a clear sugar, but milk sugar or fruit sugar, or likewise different sugars are there, and intake of the sugar, if comes to the urine, it is a patient of glycosuria or glucosuria or likewise disease. Then ketone bodies, if appear in the urine, only less than 1 milligram of ketone bodies is excreted in urine normally in 24 hours. If it appears more than 1 milligram, then definitely is a patient. An increased amount of ketone bodies are excreted in urine in starvation, diabetes mellitus, pregnancy, and ether anesthesia or alkalosis. And excess fat metabolism may include a ketonuria. Next is bilirubin and bile salts. If they appear in urine, then definitely then a patient is suffering, a person is suffering from the abnormal condition. Bilirubin is found in urine in case of obstructive or hepatic jaundice, or if blood appears in urine, it is presence, it is a lesion of kidney or urinary tract imbalance, or we can call it as example black water fever or severe burns shows appearance of blood cells in the urine. Then urobilinogen in excessive hemolysis, example hemolytic jaundice or pernicious anemia, the part of the bile pigment are appearing in the urine. Urobilin is formed from the colorless urobilinogen when the urine is exposed to air, and this gives the urine to orange color. In liver disease or temporarily in constipation, large amounts of urobilin are found in urine. Urobilinogen excreted in urine normally is 1 to 3.5 milligram per 24 hours, not more than this or not less. Then porphyrinase is the next content, abnormal content, is excreted in urine normally are 50 to 250 microgram per day. Then coproporphyria is excreted more in certain liver diseases, or the patient suffering from porphyria, the increased coproporphyria appears. So this is the chart given in normal constituent. These are the tests given for your practical study, but actually this course is not for practical purpose. Therefore you just observe it, that what are the tests, how to do the practical test for identification of urine and urine contents. So urease test, first is the urea test. In 5 ml of urine, if you will add 2% sodium bicarbonate, then pink color appears and the solution is slightly alkaline. So it means that urease is present in the urine. So likewise, oxidation test for murexidase, take 1 ml of urine sample, add 2 to 3 drops of concentrated nitric acid. Then these are the three different tests. Then evaporate it, and if you will cool it, if red color appears, if color changes to purple, if color vanishes or purplish violet color appears, then these are the different levels of uh, inferences of uric acid content. Then ammonia content, either presence or absent. Then creatinine content, Jeff's test. These are not for practical, these are only for the theoretical purpose. So if Jeff's test is you just identify it, it is for identification of creatinine, because if you will burn the solution of 1% urine in 1% sodium hydroxide solution in 1 ml, then it will turn to red. So creatinine is present. In glucose test, Benedict's test, uh, these four colors are appearing. If you will add Benedict's reagent in 2 ml of urine, these four colors are given. If green color appears, 0.5% glucose is present in urea. If yellow color appears, 1% glucose present in urea. If orange color appears, 1.5% glucose present in urea. And if red color appears, it is danger, that 2% glucose present in urine. So that diabetic patient or glycosuria patient is here. So in this way we can detect the urine. Then if Rotherh's test is used, then ketone bodies are present in the urine. So these are the 5 ml urine, add some ammonium sulfate, then saturate it. Then after 2 drops of freshly added 5% sodium nitroprusside, and 2% 2 ml of strong ammonia. If color ring is formed or color spreads throughout the solution, then ketone bodies are present. If not, then ketone bodies are absent. This is a very simple test. Then bile salt is detected by high sulfur fluoride test. In that you have to use sprinkle sulfur powder on the urine, and if it settles down at the base, then bile salts are present. And Benedict's test is the blood identification test. In that, little benzidine powder in a dry test tube, then add 1 ml of glacial acetic acid, shake well, add 2 ml of urine sample, and if it turns to green color, the blood present in the urine sample. If turns to purple color, presence of blood is confirmed. So these are the blood testing. Then albumin testing. If albumin is present in the urine, then this can be test or identified by Heller's nitric acid ring test. Take 5 ml of concentrated nitric acid, then add urine. If a ring is formed, a white ring is formed at the point of contact of these two liquids, then albumin is present. Then heat coagulation test includes 5 ml of take 5 ml of urine, then chlorophenol red indicator solution 2 ml or 2 drops, then add 1% of acetic acid, then 2% sodium carbonate till a faint pink color is appeared. Then boil for 2 minutes. After boiling, if turbidity persists, albumin or phosphate indicate the urine sample. And if turbidity disappears, albumin is confirmed. Then phosphate is confirmed in the urine sample. So these are the two tests. Then at the end of your chapter, objectives are given for your exercise. So urine is an aqueous solution of greater than 95% of water. So these are the objectives given. You read it, and these highlighted answers are given here. In previous chapter, the answers are not given. You have to find it out from the upper slides. What I have shown to you, and the lectures what I have delivered, or I have actually given the basic idea. Now these are the second up to 17 objectives are given here. Presence of ketone bodies in urine sample is analyzed by dash test. So answer is Rotherh's test that we have already studied here. So Rotherh's test is the answer in the 18th objective. So here our chapter number 3 is completed, and my part of teaching part is completed here. So next part will be taught to you chapter number 4, 5 and 6 will be taught to you by Dr. S.K. Srivastav sir. So you wait and watch unless until he is not delivering his speech. Otherwise, you can communicate to him by telephone and ask for the lectures of chapter number 4, 5 and 6. So have a good luck for your examinations and bye.